All right. We want to say greetings this evening from the Metropolitan Dallas Alumni Chapter of Delta Sigma Theta Sorority Incorporated, where Tanya Murray serves as president. My name is Kim Weaver. I am your coordinator of MDA's Emergency Response Team. And I'd like to welcome you to today's event, Vaccinations, the History and Hesitancy in Black America. So, thank you again for joining us. Our goal and our mission today is to help us understand the importance of vaccinations, the history of the hesitancy, and we know that day after day that we're getting new information. And so, without further ado, if you are live or you are close to your computers and you can put in the chat, let us know where you are beaming in from, whether it's an HBCU, your invited guest, who invited you this afternoon. We want to hear from you. And thank you again for joining us. So, without further ado, I'd like to introduce our distinguished speaker for this evening, and that is Dr. Sean Jones. He is a graduate of the great HBCU Langston University in Langston, Oklahoma, where he earned his BS degree in biology with a minor in chemistry. He continued his studies in his higher learning, earning multiple postgraduate degrees: Master of Urban Education, a Master of Business Administration, and then he went on to pursue his doctorate in organizational leadership with a specialization in research, evaluation, and measures. And there's more. He acquired over 15 years of experience both as a nuclear chemist, biological analyst, in both the pharmaceutical, nuclear, and petroleum industries for several Fortune 500 companies: Baylor Corporation, Exxon USA, and Novartis, just to name a few. Dr. Jones is also an accredited subject matter expert on vaccines and hazardous materials, so you know that we need him today. Dr. Jones is currently the lead safety analyst with safety and training responsibilities for the entire city of Oakland in Oakland, California. So we have a very distinguished guest tonight, and we're so lucky to have him. But last but not least, Dr. Jones is an active member of one of the D9 and Kappa Alpha Psi Fraternity Incorporated, where he currently serves in his local community. So, Dr. Jones, thank you so much for being here with us. We are here and ready for the learnings.
Hey, thank you, Kim, for that wonderful introduction. So let's get started. Our agenda will for this evening. We'll start with what is COVID. We'll look at the vaccine science. We'll talk about the Tuskegee experiment, and then um, what should we do as we continue to be vaccinated, as far as wearing masks, and what is our new normal. Well, let's get started. What is SARS? SARS is a severe acute respiratory syndrome known as SARS-CoV. Okay, first reported in Asia in 2003. SARS is spread by droplets when an infected person coughs or sneezes. These droplets can be propelled 3 feet through the air. Routine of exposure: mucous membranes, nose, and eyes. So let's look at SARS-CoV versus SARS-CoV-2. So the coronavirus family includes SARS, Middle Eastern Respiratory Syndrome, and the common cold. As stated previously, droplets can travel 3 feet, routes of exposure, mucous membranes, mouth, nose, and eyes, and it is zoonotic, meaning that this virus is capable of going from animal to human and human to human. COVID-19, on the other hand, is a part of the SARS family. Different from the base coronavirus, droplets can travel up to 6 feet, thus the 6-foot distance. Dries in airstreams because it becomes an aerosol. So in other words, an airstream, it'll dry and it can be carried beyond the 6 feet. in certain cases. Routes of exposure, mucous membrane, mouth, nose, and eyes yet again, and it is zoonotic as well. So I'm going to show you a short video that will give you a better idea what happens if you get the coronavirus.
This is SARS-CoV-2. It belongs to the family of coronaviruses named for the crown-like spikes on their surfaces. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs. What actually happens in your body when you contract the coronavirus? What exactly causes your body to develop pneumonia? And how would a vaccine work? The coronavirus must infect living cells in order to reproduce. Let's have a closer look. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope This is SARS-CoV-2. It belongs to the family of coronaviruses named for the crown-like spikes on their surfaces. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs. What actually happens in your body when you contract the coronavirus? What exactly causes your body to develop pneumonia? And how would a vaccine work? The coronavirus must infect living cells in order to reproduce. Let's have a closer look. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelope are spikes of protein molecules. Both a typical influenza virus and the new coronavirus use their spikes like a key to get inside a cell in your body, where it takes over the cell's internal machinery, repurposing it to build the components of new viruses. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in your mouth or nose and then move into your lungs. Once inside your body, the virus comes in contact with cells in your throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus would travel inside a sac made from your cell membrane to your cell's nucleus that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information from the virus to make viral proteins, such as the spikes on the virus's surface. A packaging structure in your cell then carries the spikes in vesicles which merge with your cell's outer layer, the cell membrane. All the parts needed to create a new virus gather just beneath your cell's membrane. Then, a new virus begins to bud off from the cell's membrane. Now, with the virus spreading in your body, how can you develop pneumonia symptoms? For this, we'll have to look into your lungs. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon. And when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries, and then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. In a healthy body, hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you might expel them by coughing. Normally, cells of your immune system attack viruses and germs that make it past your mucus and cilia and enter your alveoli. However, if your immune system is weakened, like in the case of a coronavirus infection, the virus can overwhelm your immune cells, and your bronchioles and alveoli become inflamed as your immune system attacks the multiplying viruses. The inflammation can cause your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. You could develop lobar pneumonia, where one lobe of your lungs is affected, or you could have bronchopneumonia that affects many areas of both lungs. Pneumonia may cause difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. It can also lead to more serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. These are the machines that save lives and that medical device companies currently ramp up production for. Whether you would develop these symptoms depends on a lot of factors, such as your age and whether you already have an existing condition. While this all sounds scary, the push to develop a coronavirus vaccine is moving at high speed. Studies of other coronaviruses led most researchers to assume that people who have recovered from a SARS-CoV-2 infection could be protected from reinfection for a period of time. But that assumption needs to be backed by empirical evidence, and some studies suggest otherwise. There are several different approaches for a potential vaccine against the coronavirus. The basic idea is that you would get a shot that contains faint versions of the virus. The vaccine would expose your body to a version of the virus that is too weak to cause infection, but just strong enough to stimulate an immune response. Within a few weeks, cells in your immune system would make markers called antibodies, which would be specific for only the coronavirus, or specifically its spike protein. Antibodies then attach to the virus and prevent it from attaching to your cells. Your immune system then responds to signals from the antibodies by consuming and destroying the clumps of viruses. If you then catch the real virus at a later stage, your body would recognize it and destroy it. In other words, your immune system is now primed. Collecting evidence on whether this will be possible, safe, and effective is part of what's taking researchers so long to develop a vaccine. It's a race against time to develop a vaccine amid a pandemic. Each step in vaccine development usually takes months, if not years. An Ebola vaccine broke records by being ready in 5 years. The hope here is to develop one for the new coronavirus in a record-breaking 12 to 18 months. While all of this will take time, stay home if you can, to protect the most vulnerable. And don't forget to wash your hands for at least 20 seconds and as often as possible. This video was a collaboration between Nucleus Medical Media and the...
Okay, so after seeing the video, let's look at the Pfizer vaccine. So the Pfizer vaccine is the type of vaccine is an RNA vaccine, which I'll get into later. 2 shots, 21 days apart, and it is given in the upper muscle of the shoulder or arm. What's in the Pfizer COVID-19 vaccine? Well, mRNA, it's an mRNA molecule containing genetic material that provides instructions for our bodies on how to make a viral protein trigger an immune response within our bodies. So the fat or lipid portion of the vaccine main role is protect that mRNA and provide whatever a greasy exterior to help the RNA slide inside the cell. And then we have salts, not like the regular table salt, but similar to it, that helps balance the acidity in your body. So you have sugar or basic table salt, also known as sucrose, that can also be found in the new coronavirus vaccine. This ingredient helps the molecule maintain their shape during freezing, as we know that the Pfizer vaccine has to have extremely low temperatures in order for it to be stored.
So, Dr. Jones, quick question for you, because that's one of the things I think that's been very hesitant in our culture, in saying, hey, I don't really know what's in it. So, you've just given us four ingredients, some things that we use on a daily basis. Can you
Right,
talk more about that?
there's longer chemical compound names for them, but to actually, I didn't think it was noteworthy to put the actual chemical compound on a slide. One, they're too long, and three, it's just gonna just get people disinterested when you provide them with information that they would have to go review again after such a slide deck. So basically, Kim, to answer your question, so there is an RNA messenger RNA basically is a part of our genetic sequence. And what it does is it basically takes a genetic sequence and gives your body a message. Sort of like if you type in just half a sentence on Google and it completes the Google message for you simply because there's a history of you typing in certain sentences or phrases, if you will. So that's what messenger RNA does. The remaining ingredients in the vaccine basically is about aiding the messenger RNA genetic sequence into entering the cell, and providing maintenance for the messenger RNA and allowing the vaccine to be stored at different temperatures. So what should you mention to let's talk about the things that you should mention to your care provider if you're getting the Pfizer vaccine. If you have any allergies, a fever, have bleeding disorders or are on blood thinners, or you have some kind of immunocompromise, um, which is normally associated with having cancer. There's also Lou Gehrig's disease and other diseases that cause immune responses. If you just recently had surgery, your body would also be compromised. If you're pregnant or planning to become pregnant, breastfeeding, or you received another COVID vaccine. Who should not get the Pfizer vaccine? Again, if you have severe allergies, um, you should not get the Pfizer vaccine. If you had a reaction to any of the ingredients from the initial vaccination, you probably should discontinue the vaccine. Individuals under the age of 16, and they're currently working on clinical trials for kids from 12 and up. So we're still waiting on that to get information on that. Let's look at the Moderna vaccine. The Moderna vaccine is quite the same as the Pfizer. It has the same biological pathway. It's a mRNA vaccine. One of the differences, it's a 2-shot vaccine, but it's a month apart instead of 21 days. And it's also given in the shoulder. What's in the Moderna COVID-19 vaccine? Well, like the Pfizer, it has the same RNA biological pathway. It has fat that helps grease the cell again, and salts to balance the acidity in your body and sugars. What should you mention to your healthcare provider? Same thing. If you have any allergies, fever, bleeding disorders, immune compromised, um, pregnant or plan to get pregnant, breastfeeding, or you've received another corona type virus vaccine. Who should not get the Moderna vaccine? No one under the age of 18 should get the Moderna vaccine. Again, if you have severe allergic reactions, you should not get the vaccine, or if you're allergic to any of the ingredients. Johnson & Johnson, otherwise known as the Janssen COVID vaccine, has a different biological pathway. This pathway is a recombinant replica and competent AD26 vector. It's quite different than the other two. How is it given? It's a one-shot dose. It's given in the upper arm, and unlike the other two, it has an efficacy of 66.8%. However, it's 100% effective against hospitalizations and death. What's in the Johnson & Johnson vaccine? The recombinant replacement and competent endovirus type 26 expression SARS-CoV spike protein. Basically what it is a modified, harmless version of the different virus, and it is used as a vector to deliver the DNA gene sequence to produce the corona spike protein, just as you've seen in the video. It does the same thing. The biological pathway is different. It also has acid, salt, sugars, and ethanol for the same purpose that the Pfizer and Moderna vaccines also have. Who or what should you mention to your doctor or health provider? Same thing if you have allergies, fever, bleeding disorder, or you're immune compromised, pregnant, plan to be pregnant, breastfeeding, or have received another coronavirus vaccine. Who should not get the Johnson & Johnson vaccine? Again, if you have allergic reactions, if you've been treated at any time with an EpiPen, are considered having severe reactions. So therefore, some people are allergic to nuts or whatever and carry EpiPens. In this case, if you have a severe reaction to the Johnson & Johnson vaccine, an EpiPen may be required. In addition to that, let's talk about the new warnings for Johnson & Johnson. So as you all know, there were 15 people reporting US that came up with a rare blood clotting combined with low platelets called cerebral venous sinus thrombosis with thrombocytopenia. After 8 million doses of Johnson & Johnson vaccine have been administered through April. So basically, it's an extremely low chance of people getting this type of reaction. In fact, you had a better chance of winning the lottery than to get this type of reaction from the vaccine. However, additional warnings and precautions were put in place for women under 50. Vaccine apprehensions. So I'm sure everybody has heard that somebody or someone has said, oh, they made it too fast. I'll wait on the next one. I don't know what's in it. I don't want to be a guinea pig, i.e. Tuskegee experiment. So let's look at the Tuskegee experiment. So the study began in 1932 and lasted for 40 years. It was a way for the Public Health Service to work with Tuskegee Institute and a study on the history of syphilis. So the initial sample size was 600 males, all Black, 399 males with syphilis, and 201 without. So let's look at what they did. So in 2000, not 2000, but 1926, a major health problem affecting 35% of the people in childbearing ages. 1929, treatment was toxic, deadly, less than 30% effective. 1932, the experiment actually begun. In 1936, a major paper was published criticizing the study. In 1940, efforts were made to hinder men from getting treated. In 1945, penicillin accepted as treatment for syphilis. But in 1947, men in the study are not treated, but syphilis declined. So what they did was they wanted to study the effects of syphilis and lied to a group of Black men, 600 of them, and never treated them, unfortunately. So we can now thank those 600 Black men for the science that exposed what the syphilis process is and the damage it can do to the human body. So, should fully vaccinated people continue to wear masks? Well, there's pros and cons to that. The pros are avoid being infected by a new variant, continue to influence people to protect each other, sidestep future quarantine orders, and reduce the number of hospitalizations and deaths. Um, Today, the president mentioned that if you're fully vaccinated and you've been vaccinated, your last vaccination was given 2 weeks out, that you no longer have to wear masks indoors or outdoors. I'm going to say this to all of you, that you should continue as if you weren't vaccinated. No one knows that vaccines can be helpful. Well, everybody knows that vaccines can be helpful, but everybody does not know that vaccines are not 100% effective. The efficacy or the scientific threshold or the statistic significance is 95%. So that means that, yeah, it may be effective for 95% of the people, but that 5% can still be affected by the virus. So what brings me to our cons. So the negative side about, not continue to wear a mask is, one, vaccines are not 100% effective. Increased new infections due to vaccine failure, that 5%, and or new variants that weren't a part of the studies. So what would happen because of that? New quarantine orders and continued hospitalizations and deaths. So we don't want to do that because it's most of us that are dying and not others. People of color have been greatly impacted as far as deaths are concerned by this virus.
Dr. Jones, I have a question for you. And for our viewers, definitely, if you have some questions, definitely drop them in the chat and we'll try to catch those. I want to kind of go back to, you talked about the difference in the efficacies ratings for the different viruses. Can you speak to us about why there's a difference? Why can't they all just be the same and have the same, 95% efficacy as opposed to Johnson and Johnson's
Well,
having a little bit?
so absolutely, Kim. So basically, when I mentioned these statistical significance, so for example, Pfizer and Moderna are both mRNA vaccines, and they are both are considered 95% effective. In other words, their statistical significance is 95%. So all of you who know about statistics, if you look at a bell curve, you do have outliers, but the sweet spot on a bell curve is to have it 95% significant, statistically significant. Now, if you look at the Johnson & Johnson or the Jensen vaccine, the efficacy is at 66.8%. However, it has been proven to um, have no hospitalizations or deaths. So that's huge, especially when you start looking at, let's say, a homeless population or young kids. No parent wants to continue taking their kid to the hospital for a vaccine. So, or remembering what date is day 21 or a month later. Whereas the Johnson & Johnson is a one-stop shop. You can vaccinate your homeless, whom you more likely would not be able to identify and or locate. And the odds of them being more concerned about their up and coming vaccine date or vaccination date is quite um, least on the priority list when they're concerned about shelter and food. So
Good. That's good. Because I know there are some people, you know, you hear that they got the J&J and they want to give them a side eye. It's like, wait a minute, right? But what I'm hearing from you is it's better to have a vaccination than none at all because the bigger picture is the hospitalization.
the
Um,
hospitalization, yes, that's correct. A lot of people are just apprehensive and they're just not going to get a vaccine. Um, I've even been in conversations where individuals have stated that if everybody else get a vaccine, then they don't need one. Well, that's not true. And I will speak to this. Um, a lot of people believe that, um, well, we don't know how long it's going to last. There's been people who predicted, well, 200 days or a year or whatever. At this point, the vaccines are novel, the virus is novel, and the scientific information is ongoing.
okay, that's good to know. You also talked about those individuals that unfortunately experienced the blood clots. I know that it's
Right.
a very minimal amount, but was there any commonalities in those individuals that
They
experienced
were
that?
they were all women. They were under the age of 50, and that's pretty much all the information I could find on that one. I tried to get information to see if they had any type of um, blood disease or if they had
Mhm.
RH factor or they carriers, if you will, of uh, the factor 8 type variant situation. So, um, which I found none.
Okay, cool. So you were going into what our new normal is right now.
Right.
Wear
So
your
what is
mask.
our new normal? Continue practice good hygiene and social distancing. If you guys haven't noticed, how many people, and just put in the chat, if you will, how many people have noticed people even coughing or having colds in all this period of time, or even the common flu? Has anybody had the flu or a cold during this whole pandemic? That's a really good question because people are washing their hands more and people are being more conscious of their personal hygiene. So we must continue to practice good hygiene. Avoid large crowds and venues indoors. Um, a lot of people are going to claim they've been vaccinated and have not been. Um, it's kind of like, how do you determine if somebody has been vaccinated other than them carrying their card and or the person who's operating are in charge of the venue requesting their vaccine card. So you really don't know who's what or who's doing what. So I would avoid large crowds and venues indoors. Continue wearing your mask, wear your face covering. A lot of us have gotten quite creative with styles and fashion with our
Hmm.
face coverings. Um, so continue wear your face covering and continue monitoring um, the CDC guidelines.
Cool. Well, we're getting antsy about the porch patios and the back patios, and any recommendations there. Us girls like to get together. I'm sure you guys do too. But what if you want to invite that 3, 5, 7 folks over to the backyard? Wear your mask,
Well,
not wear your mask.
I would I would wear my mask around anybody new. I just would.
Cool.
Anybody new. That's why if you keep your circle small,
Mm-hmm.
less than 10 people that you hang out with. If you go to an indoor venue and all of you are vaccinated, it's easier for you guys to maneuver that way. However, if you're having family get-togethers and or personal get-togethers with a few acquaintances or friends or coworkers,
Mm-hmm.
I would definitely consider wearing a mask.
Cool.
It's just something that we probably need to do for the next 6 months to make sure that we are safe. Because again, other people can do what they want, but it's us, African Americans, who are dying from this.
Yeah.
We've had a lot of losses.
Well, we have a
So,
question in the chat, Dr. Jones, from a Portia Jones. I know she's a SOAR from MDA. I know we talked about it a little bit earlier, but what do you think about CDC making the statement that people who are vaccinated no longer need to wear their mask inside or out?
I think it's a little bit premature, um, because we knew that one, the virus itself is not that hardy in warmer months. So it is summer or the late spring, leading into summer. And so, yeah, that might bode well for the summer, but we also know that, colds and flus um, are not common during the summer months either. So what happens come fall and the weather starts to change and it starts cooling down? Are we going to start seeing upticks in new cases? So it's better safe than sorry. Yes, I'm acquainted with the new guidelines. However, for the city of Oakland, for example, basically we're not going to loosen our COVID uh, rules. People are going to be required to wear masks indoors. They're going to be required to social distance indoors. They're going to be required to social distance outside. And if they are within 6 feet of another coworker, they also must wear a mask indoors and out. Um, Increasing the ventilation in your office areas would be a great idea, regardless of the situation. I know that in the southern states it gets quite warm, and so that may not be the greatest thing in the world. But you have to consider as well. So in a building where you have an air conditioner flowing, um, what effects that may have on the virus. We At this point we don't know as far as 100% sure. We don't know that. So just keep your guards up. Make sure that you are continuing following the old guidelines in hopes that everybody will be able to survive. We really need to focus on having less deaths of us, um, by just practicing simple hygiene rules and wearing face cover. Are there any more questions?
Kim, you're on mute.
Sorry, I was on mute, you guys. The question was from patients, what made them come to the conclusion, it's the government, not to require masks? Was there a driving force behind this? Is it trying to
Well,
get buy-in from the
well,
American
I
public?
I I, I can't speak to what the government theme is behind this, but
Mhm.
I suspect the sooner the better. We're right now, people are wanting to open up. Their businesses have suffered. People want to enjoy some sense of normalcy, and basically, if it were me, it would be a great campaign to make people who have not been vaccinated want to be vaccinated, because it's a possibility that they no longer would have to wear a mask. Um, that to me would be a selling point.
Cool. Okay, we have another question from Carolyn Simmons. If you are required to return to the office, other than the normal routine, what can I do personally to protect myself and feel comfortable?
Well, I would do a self evaluation before I leave for work. So if you are having fever, congestion, um, a cough, or any of the COVID symptoms,
Mhm.
I would stay at home. I would not go report to work. I would definitely take my temperature before I go to work. And if your temperature is above 100.4, that's considered having a fever. I would stay at home.
Yeah, I think that's good information. I know for the company that I work for, they have a link to an app that asks you a series of questions, right? And it can check your temperature, and then once you come to the office, it'll tell you whether you're able to come to the office or not. I thought that was kind of cool. And then when you get there, of course, security is at the front door that you have to show them, that you're good to go. The notification from your app.
Right.
Is anyone else that are out there that have something similar?
I know the city of Oakland, their COVID prevention program that I wrote, it is required that you do self checks at home. And once you arrive to work, the supervisor is required to ask you if you have any COVID symptoms. Have you been exposed to anybody who has COVID or is suspected to have COVID? And if so, you are required to get a test. And after testing, even if you test negative, you are required to self quarantine at home for 10 days. So the best thing that you can do, again, is to self monitor, protect your coworkers from you, and hopefully they'll protect um, themselves from you as for you, because we don't wear masks um, to prevent us from getting COVID. We wear masks to prevent us from transmitting it. Also, what I find very interesting is the fact that one of the roots of exposure is your eyes, but we're only wearing face coverings.
Mm, that's
Um,
good.
so if you go to the hospital and you notice the nurses and doctors have on masks and face shields. So there's, when it comes to the government, you really have to um, understand that they're gonna provide you with the minimum requirements.
Okay,
So you can do more than what is required, but you can't do
great. So the
less.
question, so that's a great information. So a question that I have, I know a lot of us are a part of come from HBCUs and are ready to get back to see our homecoming, our college family. With the everything opening back up, any thoughts on going back to homecoming for 2021? Any recommendations?
I
What are your
would
thoughts?
I would say if you're vaccinated, go for it. However, uh, I would still wear my face covering in buildings or indoors.
Mhm.
I would still wear it.
So, would you recommend us, those are just wearing masks right now, to also consider face shields?
Yes, I would. That face shields is a good thing.
Mhm.
But I would, just hold on for about 6 months and see how this thing runs. It's getting better, but we need to make sure that we protect ourselves. I can't emphasize that enough.
Okay. So now that we're talking about, we talked about ourselves and decisions that we can make. Tell us about, and how can we give us some nuggets about maybe some conversations that we can have with our family members that may be hesitant in taking the vaccine if they have not. But I'm going to wait, right? Um, is there any 3 or 4 pointers that we can maybe have those conversations with family members or friends?
Well, I'm just gonna cut right through the chase here. Basically, um, if you get vaccinated, at least you have a dog in the fight. Without a vaccine, you do not. So putting yourself at risk, and I'm talking about grave risk,
Hmm.
waiting on something to happen differently, well, it's not. Um, they had a blueprint for the vaccine 2 days after they discovered the coronavirus was in the U.S. Because of prior mRNA research, primarily Ebola. And mRNA research was funded by the Obama administration. So for all you guys who some people feel Obama didn't do enough for us, well, he just changed everybody's life by funding the mRNA vaccine research, because without it, we'd probably be still waiting on a vaccine.
So, speaking of waiting, I know you touched on this just a little bit earlier. What about those as far as hesitancy when we talk about, hey, we got this done like really, really fast, as opposed to it taking 5, 7 years um, for a vaccine to get approved by the FDA?
Clinical trials have not changed. Whether a vaccine is accepted via the emergency by FDA, they still have to go through the same um, trial stages, and they're very regulated. Everything from the water that goes into a pharmaceutical plant
Mhm.
and through the filters to check for microbes, to the chemicals that are used in making a vaccine.
Mhm.
The clean rooms are checked for viable and non-viable microbes, particles and particulates. They have um, high impact filters that are in formulation rooms when these vaccines are formulated. So basically, it's done, and it's in such a way that the testing is rigorous. And when the vaccine hit the market, all the material that went into the creation of the vaccine and the actual treatment trials have been documented heavily. So if you get any drug or any vaccine, there's enough documentation around safety to make sure that it is safe. However, when it comes to um, vectors and mRNA biological pathways, now we're talking about how the human body reacts to this particular, um, either vector or mRNA message. And so if you have allergic reactions to, let's say, the chemical side of it, the salts or the acids or whatever, that's one thing. But other than having allergic responses, so far the vaccines have been very hardy, and they have tracked not only the people in the trials, but they've tracked um, people who have received the vaccine. If people were exposed to someone else that had the coronavirus and they were vaccinated. So all these scenarios that have been um, implemented via organically or otherwise
Mhm.
have proven that the vaccine is effective. So if they want to play Russian roulette with their life, that's one thing, but they should think about playing Russian roulette with someone else's.
Yeah, because I think about when you share that, those who are being hesitant and saying, hey, I'll wait, you know, for whatever reason, they catch COVID, they're hospitalized, and that doctor says, hey, we have an experimental drug that we'd like to try. Would that make a difference for you?
Well, this is something I like to say that is interesting. People will try new street drugs. They don't know what's in it. People will try new cake or new product. They don't know what's in that either. But when it comes to their health, they're hesitant. That doesn't make a whole lot of sense to me. What does make sense is practicing social distancing, wearing a mask, getting vaccinated, and continual practice of these measures until you feel comfortable personally with not doing it.
So, what do you say to those who would prefer natural healing, herbs, spices,
Well,
the vaccine?
only thing I can say to them is I hope it works for
Okay.
them. I mean, that's not science.
Hmm.
Um, and that, yes, there's a lot of religious people too that said they're gonna wait on God too. Well, I often reflect on that story about the man in the boat in the ocean. That God sent him a ship and he sent him a cruise ship, and eventually the man is swallowed up by the shark. He gets to heaven and God said, well, I sent you a cruise ship and I sent you another boat. It's the same thing with the vaccine. You can pray, that's great, but
Hmm.
God has sent you a vaccine. You might want to take it.
And speaking of the vaccine, we've heard a little bit about potential booster.
So there is a
About
thing called an adjuvant, which is a kind of like a steroid type boost. It's not a steroid itself, but what it does is it helps your body produce more antibodies. So the conversation around a booster or an additional vaccine has been brought to the table because of the different variants.
Mhm.
For example, the the UK variant is 70 times more contagious than the original coronavirus that people were experiencing, let's say in November of 2019 and the beginning of February in 2020.
Cool. So we are getting close to the end of our hour. We are looking for additional questions. Dr. Jones, any final thoughts that we can take away to keep us encouraged. I know we now think about getting those face shields, which
Right.
no one's really talked about.
Right.
Having those conversations with our family, truly understanding the Tuskegee experiment, that they were not injected
Right.
with syphilis, that they just were not treated under with the assumption. And this is a great comment. I want to catch as many as I can from the chat. This is from Winona Harris. She said the problem is this virus has been politicized and people are making decisions based on politics.
Well, I'll say this: there's no politics in death. When you die, you're dead. No matter if it's from a coronavirus, a gunshot, or whatever. Once you're gone, you're gone. So with over 25 million people worldwide contracting the virus, and we're looking at over 500,000 people dead in the United States.
It's real.
That's real. That's not politics. That's death. That's a pandemic. So yes, it's been politicized. That's probably mostly why we're here,
Mhm.
because people refuse to wear masks and social distance because of politics. Well, there's no politics in death. I can't say that enough. Follow the science. If they had to follow the science in the beginning, maybe half the people who died would still be here.
So as we're coming to a close, what do we do going forward? Going back to the title of this segment is the vaccine, the history and the hesitancy in Black America. And I feel like we've done a good job in addressing a lot of those questions, thoughts, probably a little bit more than we anticipate. And I appreciate you for that. But as we walk away from this session today, what would be your big two or your big three that we need to just clutch our pearls and hold on to?
That the numbers have gone down because of several reasons. One being 200 plus million people in the United States have been vaccinated. The other is that we're practicing better hygiene, obviously, because people are not even getting sick from other common things like like a cold or the flu. Those things are down.
Mhm.
So if you take into account good hygiene practices, maintaining your social distance, limiting your social network to just people you know or people that you've known to be safe and have been vaccinated, those things will help. But again, we need to practice caution and rushing to remove our mask simply because they're removing theirs.
Got
It don't affect them as much as it affects us.
it.
So
And I
keep
think
that
I've
in
heard
mind.
Tyra say it multiple times, wash your hands, wash your hands, wash your hands.
Right.
Tyra, for I see you to do that. Well, Dr. Jones, you have been amazing. I know you are a super, super busy man, and we appreciate the time that you provided us today. For all of our viewers that are out there in Facebook Live land, this is coming to you from the Metropolitan Dallas Alumni Chapter with Delta Sigma Theta Sorority Incorporated. I am Kim Weaver. I am your emergency response team coordinator for MDA. Thank you for your time. We hope you've learned a lot today. Be blessed, and we'll see you next time.
Bye, everybody.